Rabies remains a public health problem here in the Philippines, and data from the health department show at least 300 Filipinos die of rabies every year. How is the government dealing with rabies? And to tell us more about that, we now have on the line Dr. Ronald Quintana of the Health Department Rabies Prevention and Control Program. Good morning, Doctor. Thanks for taking our call.
Good morning, Doc Freddy, and good morning to all the televiewers of your program.
Now, Doctor, is there an increase in the number of rabies cases now?
Well, to answer your question, based on the data that we have, which came from the report submitted to us by the Department of Health Regional Offices, which we now call Centers for Health Development, from year 2007 to year 2017, the trend of the number of human rabies cases is generally decreasing. There are years, however, when the number of human rabies cases is higher than the preceding year. For example, in 2016, we had 209 cases of human rabies, and it increased to 219 in 2017. And for the first 3 quarters of 2018, based on the partial report submitted to us by the Centers for Health Development, we have a total of 170 cases of human rabies. We are hoping that if we receive the complete reports from all Centers for Health Development, the total number of human rabies cases for 2018 will not be far above or way above the 2017 figure. And then for the number of animal bites, Dr. Freddy, from year 2007 to year 2017, the trend is increasing. Since 2016, we now have over 1 million cases of animal bites each year. And in 2017, we have a total of 1,298,414 cases of animal bites. And for the first 3 quarters of 2018, again, based on the partial reports that we received from Centers for Health Development, we have a total of 670,103 cases of animal bites.
Okay, so the general trend, Doctor, is that it is going down, which is a good sign.
Yes, it is.
Now, even if the trend is going down or at least remaining stable, do we have enough vaccines for rabies?
Well, right now there is a global shortage of human rabies vaccine, and the Philippines is not spared from the effect of that shortage. We at the Department of Health, through the National Rabies Prevention and Control Program of the Infectious Disease Office, are doing our best to address and provide the need for human rabies vaccines. The National Rabies Prevention and Control Program took some measures in facing the global shortage, such as the revision of the guidelines for the management of human rabies exposures. The Department of Health, again, through the National Rabies Prevention and Control Program, yearly allocates budget for the procurement of human rabies vaccines and rabies immunoglobulins. But unfortunately, the local suppliers or distributors of human rabies vaccines in the Philippines could not provide the quantity or the bulk of human rabies vaccines that the Department of Health is procuring. And to address this gap, the department, through the National Rabies Prevention and Control Program, provided substantial amounts of sub-allotments to all the Centers for Health Development, including San Lazaro Hospital and Research Institute for Tropical Medicine, that they used to procure human rabies vaccines. And recently, in December 2018, we had a successful bidding for the procurement of human rabies vaccines, and the delivery of those vaccines is ongoing. We have already allocated the delivered vaccines to all the Centers for Health Development, including San Lazaro Hospital and the Research Institute for Tropical Medicine, and they are now ready for delivery to and for pick-up by the Centers for Health Development.
Okay.
We are also continuously advocating for the local governments to procure anti-rabies vaccines both for dogs and humans, to augment the vaccines that the government is procuring, and with the Bureau of Animal Industry of the Department of Agriculture for the local governments to also conduct mass dog vaccination.
Okay, Doctor, what should a person do naman if nakagat sila ng stray animal or wild animal na hindi sila sigurado kung na bakunahan itong animal na to for rabies, what should they do first? Let's start with the first aid muna.
Well, the first thing that they should do if they are bitten by a suspected rabid animal, such as dogs or cats, they should wash the wounds immediately and vigorously with soap or detergent and water, preferably for at least 10 minutes. And if soap is not available, the wound should be thoroughly and extensively washed with water. They could also apply alcohol or povidone iodine or any antiseptic. And then after that, they should go immediately to the nearest health facility or animal bite treatment center for proper management and be given anti-rabies vaccine or immunoglobulin if necessary or if indicated.
Okay, now thank you, Dr. Ronald Quintana. He's the program manager of the DOH Rabies Prevention and Control Program.